All right, welcome back to Daybreak. As it's now 6:45 in Nairobi. But I understand that in Daegu, in South Korea, it should be, what time is it there? It should be 12:45, just 15 minutes before 1 o'clock in the afternoon. And you're here to speak to Valentine Wanjiku, who is in South Korea. She is a student and also a communications professional. Good morning, Valentine.
Yes, it's afternoon here.
Good afternoon. Look at me.
Good afternoon, good morning.
All right, so different worlds, different time zones. But I want us to begin the conversation with the numbers that we are seeing in South Korea. I remember yesterday as we were speaking, it was just about over 8,000. And now it's 9,000 and I think 37 cases. What would you describe the situation that you're seeing in that country now with the global pandemic that has rocked different countries? How would you describe the response and the status there in South Korea?
Okay, before I speak on that, I'd just like to emphasize on one thing. As we're looking at the numbers of confirmed cases are good to look at. But one of the most important numbers to look at are the numbers of people who are being tested. So yes, we can say that this country has 34 people, this country has this number of people who are confirmed, but the main question is how many people have been tested. And so if you can compare, like in Korea right now, over 300 and something thousand people have been tested, you know, so there's an important point in looking at that.
Right.
And so saying that, in South Korea, so I'm currently in Daegu. I've been living in South Korea for about 6 years now, and I'm normally between Seoul, which is the capital city, and Daegu. But when this, I study in Seoul and I'm working and serving in Daegu. But when this happened, I was in Daegu. And so when I was in Daegu, and South Korea till mid-February was handling this situation, you know, very well, and they still are. We were controlling the situation in terms of numbers, and so we had less than 100 people who had it until this one time where there was a patient 31 who is said to be a famous patient 31 who came down to Daegu. There were some patients who came down to Daegu, and after that, the following morning, just the numbers were rising really high.
Right.
And I remember we were very worried in Daegu at first because of the high rise in numbers, until we looked at the whole situation and saw that compared and the numbers of how many people were being tested. And so at some point, South Korea was number 2. Right after China, and it spiked up. We went up really high, and majority of those numbers were from here, Daegu.
Right.
So thousands in Daegu coming from Daegu. And
just to be specific, Valentine. Just to be specific, when you talk about patient number 31, what exactly did he or she do that the cases now started to skyrocket?
Okay, so patient number 31 did not, along with the fellow congregation members, are said to have come from a specific cult. They were not giving enough information about where they were going and enough information to help the government track this down and manage the whole situation. Right. And so that's why the numbers skyrocketed, and not really observing the laws of quarantine. And so that's how the numbers skyrocketed here. Somehow. It can contribute to that. But let me just go back to the question on what I think has been happening here and some of the things that I'm really grateful for. Okay, so actually being in South Korea, one thing that I thank the government for, the Korean government and even the Kenyan embassy in South Korea, is transparency. Transparency and effective communication. And technology too. Why do I say that? We were able to get the right and up-to-date information on how many people have the virus, where did this patient go, Which coffee shop did they go to? You know, once they find out that you have it, then the government was tracking down each and every place that you've been to and updating that on site. So we'd be able to just log in and see the history of where this person has been, which places not to go to. So that really helped us in terms of calming down and cooling down. We were a bit worried at some point because of how the numbers were shooting high until we realized that, you know, it's because the country was testing a lot.
Okay.
Another thing that I found to be very helpful was how the Korean government is taking care of Koreans, not only Koreans, but the foreigners as well. So let me give my story being in South Korea. So the first week we found out this happened, I decided to just stay indoors. The second week we were told to self-quarantine, and that's including the churches, schools were pushed back. And we were just all indoors the whole time. And people were obeying this and staying indoors because they realized this is something you do together, you know. And people were buying masks, face masks, and sanitizers and all that. But they didn't really hoard so much. And so by the second week when we were all indoors and there was no case in Kenya, the Kenyan embassy and through the Kenya community in Korea, I do public relations in the Kenya community in Korea, they were able to reach out to us in Daegu to find out, are you people okay? Do you need anything in case, because you're indoors, you're quarantined, you're not leaving the house, might you need masks, might you need this and this? And so they were trying to figure out. So we really appreciated the communication to that point, and some of the embassy officials said that they would have daily meetings to report on what was happening. And so through this communication, we were able to feel like we were taken care of. And by the third week, one of the major issues was masks, but by the third week, the Korean government had set a system where, by masks, what do I mean? People were buying face masks to protect themselves. If you at all you're leaving the house, because one way, you know, this can be spread is through droplets, like, you know, coughing and spit, and so this protects you. And so face masks and sanitizers, but people bought them and we were lacking face masks and sanitizers. And so the government set a system whereby anyone and everyone can buy this face mask, at least two face masks per week. So that helps people who are not able to access it. But the first thing was that if you have national insurance, that you can buy this face mask. But some of the students don't have this national insurance, so they would not be able to buy this face mask. But then again, here comes communication where the diplomats now talk to the government, and then now they come up with, then they tell us that even those foreigners who do not have this insurance they can be in a position to access it. Buy them, so that helped. But just before you go on, Valentine, to note, is the free medical checkups.
Valentine, just before you go on, so that we're able to cover as much as we can. So yes, a quarantine was invoked by the government of South Korea. Were you affected? Have you been tested for COVID-19? What were the symptoms?
Yes, so I was getting right to that. So a quarantine was set up and we were indoors. And so they told us, well, it wasn't very strict in the beginning. They just told us to stay indoors. And it's specifically serious if you have been in a building or around someone who has it, a building, not even in the same room. If you've been in a building, you stay and you're quarantined for 14 days. They would say if, for example, in this specific building, there's one person who has it, then the whole building would be shut down.
Whoa, okay.
The whole building, regardless. They don't care, like they shut down the whole building and you're all sent home. You're all family members. They were not taking risks. So that's how they did it at first. And so personally for me, how I was affected, is that, you know, at first I was just deciding to stay at home on my own, but on around second or third week, I was in a building where someone had it, but that wasn't the main thing. The main thing was I was having chest pains. So with this chest pains, I needed to go for a checkup. But going for a checkup, I have a history of having asthma, but I could not. The number one place you're not allowed to go to first if you suspect you have the virus, is the hospital.
Yeah.
You cannot go. They'll chase you away. Why? Because when I go to the hospital and I suspect I have it, I put everyone who's in the hospital at risk of getting this. So what they did is they put up toll numbers. So if you suspect you have it or have the symptoms, call the number.
Okay.
So there are two ways they were doing it. So if you suspect you have it or have the symptoms, call the number. Or if they get your information and find out that you are around someone who had it, because they've been